The situation on the ground is pretty terrible, as it is visible to everyone. The systems have more or less nearly been overrun. The hospitals do not have beds. There was an acute shortage of oxygen in the beds in the country, and some of these so-called essential drugs, and remember remdesivir and favipiravir are considered essential in India for early treatment of COVID-19, despite adequate evidence. The hospital beds are not there. The death rate has risen exponentially, and the situation is a bit like it was in the New York at the onset of this problem, when even simple things like hearses and burial grounds were not available. So it is indeed a terrible situation in India right now.
How are you managing that, even from a personal perspective, Dr. Rai, looking at the devastation that you're describing in a place that you serve?
So all of us must do our bit. I'm a vascular surgeon. I'm chairman of a department of vascular surgery. But for the last 2 weeks, I have doubled up as a COVID doctor. I'm giving free online consultation to any patient who needs it, and I'm managing them close to their home. I'm spending about 10 to 12 hours a day doing this, talking to the patients, their caregivers, and helping them. It's like a kind of a drop in the ocean, but there are many doctors like me who are doing it. At the systemic level, we are a not-for-profit organization, and we are trying to spread the message of the devastation in a professional manner, and we are trying to focus on the vaccination bit. Because part of the problem in India is the vaccination never took off the way it was meant to be. So there's an urgent need. Of course, the benefits would kick in after a month or two, but that is the crying need. And we absolutely admire the way US and several Western countries have controlled COVID by way of vaccination.
We just spoke with a member of Congress here in the U.S., Illinois Congressman Raja Krishnamoorthi, who's calling on the Biden administration to release stockpiles of the AstraZeneca vaccine here to India. What kind of a difference, and we should know that has not been authorized in the U.S., what kind of a difference might that make for India if that were to happen? And would you like to see it happen?
Oh, absolutely. And the reason is that of the two vaccines, AstraZeneca vaccine was the one, and it has already been given to a very large number of people, I think several million. And we have experience with that. So if we get that vaccine, or any vaccine for that matter, whether it is the Pfizer or Moderna, but especially AstraZeneca vaccine, that would be very good for the country.
What is the one thing that you need the most right now, Dr. Rai? Is it the vaccine? Is it something else? Is it, physical help in the form of doctors? What is the one thing that you think could help India turn the corner here?
I think that's a very difficult question to answer. We need all of these. And wherever anybody can club in, whether it's an individual, whether it's an organization, whether it's a philanthropist, whether it's another national government, it would be welcome. We need doctors, we need paramedics, we need medicines, we need oxygen, and we need vaccination. We need all of these. Clearly, vaccination probably in a slightly medium term, but right now the other things. And as I said, with so many doctors suffering from COVID and the paramedics suffering from COVID, they are at a very thinly stretched out in the hospitals. So we are all trying to jump in, and people like me, I'm 64, and we have even offered that we will go and man the wards if required in the hospitals. Fortunately, it has not come to that, but this is the kind of situation India is in right now.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.